My name is Alex Bendt. I'm an occupational therapist and certified hand therapist here at Grand Island Physical Therapy. We are located at the sports clinic on Deers Avenue. We are inside the sports clinic. We're kind of the hand clinic area. Today we're going to be talking about some splinting here. We have Katie here. She's been dealing with a little bit of thumb pain, and so at the hand clinic we can make different kind of braces based on your injury. We custom make them so they can fit your hand and your type. Everybody's a little different size, usually has different swelling, different issues, different curvatures of the bone. And so the nice thing about the material we have is we can contour it to different areas, different joints, and make it custom fit for the patient, so it's not a one size fits all that you'd buy in a store or something like that. So with that, we can specifically address the area that we need to based on the custom fit brace. So today she's dealing with some thumb pain, kind of through the MP joint here, and so we're just going to make her a little custom splint here that'll stabilize this joint here. She'll still be able to use her hand. Promoting functional grasp is a big thing of therapy. Your hands are a key tool for daily living, and so we try to stabilize the area we need to without restricting other areas that would limit her daily functional use. So we're just going to stabilize the joint she needs to, let her fingers be free, the tip of her thumb be free, so she can continue to do her daily living, her work tasks, and just improve her function by stabilizing the joints she has affected here. So this is considered a thermoplast material, and so basically we can heat it up in some warm water, and then we can mold it around however we feel fit. And so like I said, we're going to try to kind of mold it around the joint that she has affected, which is this joint right here, and then kind of stretch it around her hand for a custom mold here. We try to smooth out all the surfaces, so when she's bending her fingers, there's no sores or wounds that develop around that. And then we just let that material back and form up, and so it's nice and hard and kind of stabilize what she needs supported. So go ahead and bend your thumb. Good. And straighten it. Do some thumb circles for me. And relax. We just have her do a little motion so that material doesn't get too snug on there. And like I said, this brace, she'll be allowed to move her thumb and her fingers so she can still pick up objects, have a good grasp, but it'll stabilize the joint she needs. This is just one example of braces we make here. We also do ones all the way for the wrist, specific fingers, the elbows. Sometimes these are just for things like tendonitis. Other times they're post-surgically, like sometimes they do joint replacements of the thumb, or in the elbow they do ligament repairs or nerve releases. Or more of your traumatic tendon injuries and things like that. We can make dynamic splints, which will help aid functional use. They actually help move your fingers, and all sorts of different stuff, just based on the person's injury or condition there. So it's not too long of a process. It's custom molded. That material fits real quick and dries. And then Katie's ready to go and use that for her daily activities. So now we have the custom mold here done. So what we need to do is we just need to put some Velcro straps on there so that the patient can take it on and off. So we just use sticky back Velcro here. Stick one piece on one side. Do the other piece on the other side here. And then she would just stick it on like this. Creates a nice stable brace there that she can take on for things like showering and stuff. Basically, to remove, she takes off the back strap and she can simply slide off the custom molded brace. Good supportive here to help stabilize where she's having issues there. So that's just one thing we can do here at Grand Island Physical Therapy. Specifically in the hand clinic, we treat anything from the fingertips up to the elbow, sometimes up to the bicep. This is something we custom make only here at our clinic, and we use these to address very different areas. We also do things like modalities like ultrasound, stretching, strengthening, work stimulation, anything to address anything in the upper extremity. So if you're having any of those issues, make sure to check us out. You can find our links on our Facebook page and stuff like that. Also feel free to give us a call anytime. And we'll be happy to help you out.